Have you had symptoms during menopause that didn't feel like anything you've read about? Something that showed up out of nowhere, and when you looked it up, none of the usual lists mentioned it? You're not imagining it, and you're not alone. There are 10 unusual menopause symptoms that rarely get mentioned, even though they're well documented. And I'm Dr. Paul, here to walk you through what's actually happening in your body with each one. Number 1, itchy skin. Estrogen plays a major role in keeping your skin supple by supporting collagen production and natural oil levels. When estrogen drops during menopause, both of those decrease, which leaves skin drier and thinner than it used to be. Thinner, drier skin is more reactive to irritants, and that irritation is what creates the itching. Some women describe it as a persistent, hard-to-place itch that isn't tied to any rash or visible skin change at all. If you appreciate me making this type of content, let me know by gently tapping that like button. Number 2, breast heaviness and soreness. As estrogen and progesterone shifts during this transition, fluid retention in breast tissue can increase, which creates a sense of heaviness or density that wasn't there before. As estrogen continues to decline, glandular tissue can also change, which is part of why breasts feel more tender than usual, even without any other explanation. Number 3, burning tongue syndrome. This is exactly what it sounds like, a burning or scalding sensation on the tongue, lips, or inside of the mouth, often with nothing visibly wrong when you look. Hormonal changes during menopause can affect saliva production and nerve endings responsible for taste. And that combination is what produces the burning sensation for some women. Quick request, if you're finding this useful, go ahead and subscribe and check the description in the pinned comment below for sources I'm referencing today. Number 4, dizziness. Estrogen helps regulate blood vessel function, and as it declines, some women experience brief drops in blood pressure that shows up as lightheadedness or a spinning sensation. This can be startling if you don't know it's connected to hormones, since it often shows up with no clear trigger. Number 5, changes in body odor. Estrogen helps maintain a balance of bacteria on your skin. As estrogen drops, that balance can shift, allowing different bacteria to become more prominent, which can change how your natural scent presents. Hormonal shifts can also affect sweat production, which adds another layer to this change. Number 6, electric shock sensations. Some women describe a brief jolting feeling just under the skin, almost like a small electrical zap. This isn't fully understood yet, but it's thought to be connected to how declining estrogen affects communication between your nervous system and the rest of your body, sometimes producing these odd, brief sensations, even when nothing else feels wrong. Number 7, changes in your voice. This one surprises a lot of people. Your vocal cords sit within the larynx, and that tissue is sensitive to hormonal changes, particularly through perimenopause and beyond. Even small hormonal shifts can affect the pitch and vocal quality, which is why some women notice new hoarseness, a change in vocal range, or more frequent throat clearing during that transition. Number 8, ear and hearing changes. Estrogen supports healthy blood flow to the inner ear and helps protect the delicate hair cells responsible for turning vibrations into sound. As estrogen declines, that protective effect lessens, and some research points to a connection between menopause and an increased risk of hearing changes over time. Number 9, new or increased allergies. Estrogen plays a role in regulating immune response. The immune system can become more reactive than it used to be. That's part of why some women develop new sensitivities or notice existing allergies getting worse during this transition. And number 10, heart palpitations. A racing or pounding heartbeat that comes on suddenly, sometimes while you're just sitting still, can be genuinely unsettling. Hormonal fluctuations affect your autonomic nervous system, which regulates heart rate, and that's why palpitations can show up even when a full cardiac workup comes back completely clean. To be clear, this doesn't mean you should assume every instance is hormonal and skip getting checked. It means don't be surprised if the workup comes back normal and the explanation turns out to be hormonal after all. So what should you actually do with this list? First, know that all 10 of these are documented real symptoms. You're not imagining them, and you're not overreacting by bringing them up. Second, if you're experiencing several of these together, that pattern itself is useful information to bring to your provider, since these symptoms are rarely evaluated as connected unless someone specifically asks about hormones as the underlying thread. Third, a few of these, particularly heart palpitations and severe or sudden dizziness, do warrant getting checked out to rule out other causes first, even while hormones remain the most likely explanation once those are excluded. If you recognized yourself in more than one of these, drop a comment below with which one surprised you the most. I read every comment, and it genuinely helps me to know what to cover next. And if you know someone going through this who's been told everything looks normal, send them this video. This list might be the validation they've been quietly looking for. So to bring this together, menopause is much more than hot flashes and mood swings, even though that's almost always what gets talked about. These 10 symptoms are real, they're connected, and now you know what to actually look for and what to bring up with your provider. If this was helpful and you want to understand the broader hormone imbalance picture behind all of this, I actually made a video breaking down the signs most people miss entirely, and you can check that out by clicking right here. Thanks for watching.